Thank you, Mr. Speaker. This government has mismanaged our healthcare system for years. Illegal donations from health executives, outrageous expenses on alcohol and fine dining. Now Alberta doctors are saying they've had enough of the abuse from this government and enough of living under the most oppressive, intimidating environment that any group of professionals could find themselves in. Will the Minister of Health finally recognize that years of systemic waste, abuse, intimidation and disrespect on the part of this government has led to this crisis situation and immediately change his course of action and start addressing the obvious concerns of our health professionals?
Well, Mr. Speaker, my ministry and Alberta Health Services work with health professionals every day on a variety of issues which are of concern to this member's constituents, as to all of our constituents, issues with respect to access and quality in our healthcare system. A very good recent example, Mr. Speaker, is the work of our health professionals that resulted in a significant reduction of occupancy rates in acute care bed hospitals and a very major reduction in the number of patients waiting for placement in continuing care.
Honourable member.
They don't trust you, Fred. Doctors have absolutely, Minister of Health. Doctors have absolutely no confidence in this minister. Doctors are now moving towards job action. So why should Albertans in general feel any confidence in this government and this minister when it comes to health care?
Honourable Minister.
Well, Mr. Speaker, if I might, I think what Albertans are going to lose trust in is an official opposition and other opposition parties that persist in undermining the credibility, the hard work and the service of health professionals, and that seek to undermine public confidence, I should say, or at least it would appear so, in the healthcare system as a whole. Mr. Speaker, our job as government is to work with health professionals. We are doing it. We are having constructive dialogue. We do have issues in labour relations to deal with in a number of professions. And Mr. Speaker, with all due respect, we do not need a mediator in the form of members of this opposition to help us with that. Thank you very much.
Given the response of the AMA, clearly you do need a mediator. The minister's actions have shattered the trust of your health professionals and damaged the healthcare system for Albertans. When will this minister provide a plan to Albertans with any certainty on how to regain our trust?
Honourable Minister.
Mr. Speaker, trust and confidence and job satisfaction on the part of health professionals and others that support the system is first and foremost affected when they hear constructive dialogue among their elected representatives about opportunities and hard work to overcome challenges. The people that work in our health system, Mr. Speaker, are the ones that are delivering on this. And quite frankly, I don't think they appreciate the persistent overtures from members of the opposition to suggest that they aren't doing their job. They're doing it very well, Mr. Speaker.